Differential diagnoses. At first we considered Van Gogh to have schizoaffective disorder bipolar type because he displayed symptoms of both schizophrenia and bipolar I disorders, such as delusions and episodes of mania and depression. However, we had no evidence that he had been delusional for a period of 2 weeks in the absence of a mood disorder, as the DSM criteria state, and therefore decided to rule this disorder out. In addition to ruling out schizoaffective disorder bipolar type, we were able to rule out delusional disorder. While Van Gogh did exhibit signs of this disorder by simply having delusions, we were able to rule it out because the features of delusional disorder do not include prominent visual or auditory hallucinations, which Van Gogh did display. The delusions of delusional disorder are sometimes thought to be possible, but nonetheless lacking in evidence. The delusions of schizophrenia and the delusions exhibited by Van Gogh are much more unrealistic and not at all believable. Another disorder we were able to rule out was the substance-induced psychotic disorder. We were able to rule this disorder out because his auditory and visual hallucinations were not due solely to the use of absinthe or alcohol. We believe that the delusions and hallucinations he suffered were due to schizophrenia. Besides substance-induced psychotic disorder, we also ruled out schizoid personality disorder. We considered this disorder based on the fact that Van Gogh lacked close personal relationships. While he did not have many close friends, he did, however, have a desire for them. This is evident in his longing to have a society of painters and his repeated marriage attempts. Therefore, we did not diagnose him with this disorder. Aside from schizoid personality disorder, we also ruled out disorganized type of schizophrenia. Although some of the criteria for the disorganized type of schizophrenia were present, Van Gogh did not exhibit any signs of flat or inappropriate affect as listed by the DSM-4. All of the listed criteria are necessary to render this diagnosis, which is why it has been ruled out. In addition to ruling out these disorders, we also ruled out alcohol abuse disorder. While many sources refer to his continuous use of the alcoholic drink absinthe, as well as his own self-proclaimed near-alcoholism, we could not find enough supporting evidence to show that Van Gogh was actually dependent on or abused the substance. There were numerous medical conditions that were definitely considered in the diagnosis, such as lead poisoning, malnutrition, and syphilis. However, we were forced to also rule these out since we do not have the appropriate certification to diagnose medical conditions. If only Van Gogh was born in this era instead of the 1800s, and if only he hadn't committed suicide yet, there could certainly be hope for him. The first step would be, since we know now that his suicide will eventually occur through hindsight, to commit him to a modern psychiatric hospital where he could be monitored for substance abuse and self-harm. Once there, he could most likely be set up with a personalized recreational therapy program allowing him to paint as much as he desired. Not only could this provide him with something to fill his days, but also it could act as a barometer of his changing moods for the nurses and doctors watching over him, depending on how much he paints, what he paints, and how he paints it. Here he would probably also be administered the Minnesota Multiphasic Personality Inventory, MMPI, to verify or possibly contradict our primary diagnoses, and perhaps other psychological evaluations such as the Rorschach test. Either way the test results pointed, we would hopefully be closer to the truth. As far as medication, we would, as novice abnormal psychologists, most likely prescribe an antipsychotic neuroleptic medication such as Abilify, which has been FDA approved for both the treatment of bipolar I and schizophrenia. He'd be started on a beginner's dose of between 5 to 15 milligrams every morning, increased if the side effects are minor enough to continue. This medication would help to correct his distorted thinking and hallucinations, as well as regulate his mood cycles. If the medication didn't work as hoped, other options could be explored. The standard medications for treating his borderline personality disorder are tricyclic antidepressants to combat his suicidal ideations. However, since tricyclics have a shady history of increasing psychoses, this would most likely not be advisable in Van Gogh's case. Lithium could be administered instead, under observation. Some SSRIs could also improve his moods, for example, Lexapro, Zoloft, Prozac, Effexor, or Paxil. For outbursts of anger or rejection anxiety that are common with borderline personality disorder, a tranquilizer, such as Xanax or Klonopin, could be administered by the staff to calm him down, depending on the average length of each episode. However, since his absinthe use is indicative of the possibility of addiction, it would not be advisable to give him his own private supply of these controlled substances. But regardless of the specific medications, cognitive behavioral therapy would be a must for Van Gogh, both during his inpatient stay at the hospital and later outpatient therapy, starting twice a week and tapering down to once a week, once every 2 weeks, once a month, and so on if his symptoms improved. There he would learn new coping strategies for the stressors and disappointments in his life that would otherwise trigger suicidal behavior. This would help him become better adjusted socially, less suicidal, and less erratic emotionally. In addition to the use of medications and counseling, the use of psychosocial intervention could also be applied to these disorders. Psychosocial intervention includes educating the patient and the people closest to them. This type of intervention teaches them how to deal with the problems associated with these disorders. In the case of Van Gogh, this type of treatment would be helpful in dealing with the symptoms of schizophrenia. One example of psychosocial intervention is a token economy. In a token economy, individuals earn items they exchange for desired rewards by displaying appropriate behavior. Assuming his condition improves through therapy and medications, he could go back to living by himself with regular appointments with his psychiatrist to regulate his medications and maintain balance among the chemicals in his brain. With the rather large arsenal of treatment possibilities available today, it's actually quite a shame that Vincent Van Gogh was born and died so long ago when they couldn't do as much for him. If only he had been born today. But on the other hand, without the manic episodes, he wouldn't have painted all that he did. Without his abnormal imagination and hallucinations, quite possibly his contribution to the world of art would have been compromised. But on the other hand, his suicide certainly compromised his artistic career far more than any lack of creativity could.